Hello everyone and welcome back. And in this video we're just going to use our handy little skeleton here to demonstrate why we use a technique called breaking the bar in relation to shoulder injuries. In particular, rotator cuff, or the most common type, supraspinatal tendinal inflammation or tendinal tears. Mostly the common nickname would be swimmer's shoulder, and one of the clinical presentations would be when the patient abducts their arm out to the side. They get pain in the first 20-30 degrees of lateral abduction, and if it's really severe, full 90 degree, they're not able to hold with a full thickness tear. We've described this in a previous video. So one of the reasons we break the bar on exercise prescription advice is simply it opens up the space in the supraspinatal fossa for the muscle to breathe as we move through the planar movements in the push-pull motion. Simply what that means is our supraspinatus muscle sits in the supraspinatal fossa, runs through and attaches onto the top of the shoulder. Now if we abduct our arm 90 degrees, it tends to approximate towards the acromial plate at the top. So the external rotation added in, whether it be any pushing movement, the external rotation, which if is done bilaterally, is called breaking the bar, externally rotates and gaps, as we can see, the space between the acromial plate and the proximal humerus, and allows the supraspinatus tendon some space to breathe as it passes through. This also decompresses the subacromial bursae, which can also generally get inflamed along with a problematic supraspinatus tendon. So again, the internal rotation tends to approximate the two joints between the acromial plate and the proximal end of the humerus. That external rotation lowers it down and gives a bit more gap in between the two spaces. So what that looks like on a shoulder pack with a patient is if they're standing with their hands in front, close the fists, squeeze shoulders back and rotate back through the scapula, and it's called breaking the bar. Imagine we have a stick in our hands or a bar and we're trying to break the bar. So I hope that helps. Thanks a million for watching.